Welcome, everyone. As students and folks are getting settled in the Zoom space, looks like some folks are on the go, which is great. Thanks all for logging in. My name is Cassie Petoskey, and I use she or they pronouns. I'm the director of the Waldron Student-Alumni Connections program, where our goal is to help Weinberg College of Arts and Sciences students explore career options through connecting with alumni. So we're so excited to hear from our great alumni speakers today on healthcare and public health administration. And before I pass it over to our student moderators to lead the discussion, I just want to remind students who are on the line with us today, please feel free to rename yourself with your class years and your pronouns on your Zoom name, just so we know a little bit more about who we're speaking with. And of course, I always encourage students to turn your cameras on if you're, able to, and up for it this morning, because it's really nice for us to know a little bit more about who we're speaking with throughout the program. And so without further ado, I'm going to pass it over to Mirabella and Andrea, our student moderators for the session.
Wonderful. Thank you, Cassie. We're all really excited to be here today. As Cassie mentioned, thank you all again for being here for this really awesome alumni program that we're about to have. My name is Mirabella Johnson. I use she, her pronouns. I'm a senior, and I will be moderating the conversation today with Andrea. So Andrea, would you like to quickly introduce yourself?
Sure. Hi, everybody. I'm Andrea. I'm a senior. I study neuroscience and global health. I use she, her pronouns, and you can direct any questions that you may have during the conversation to me.
Perfect. Thank you so much, Andrea. So now, without further ado, we have a great lineup of alumni speakers to share their insights with the group today. Once we hear from them, as Andrea mentioned, for about 40 or so minutes, we will take questions from the audience, which is a great opportunity to clarify, to get follow-up information, and so on. If you want to turn on your mic at that point to ask your question, please submit your question via the public chat tab, and we will call on you. However, if you'd like us to read the question out to our panelists, please send your question through a private chat to Andrea. So without further ado, let's get started with some introductions. I'll snake through the panelists for today, but the first person I see is Rochelle. So Rochelle, could you tell us a little bit about yourself?
Sure. Good afternoon. My name is Rochelle Brown. I am a board certified internal medicine physician. I reside in Lexington, Kentucky, where I'm from. And I graduated from Northwestern with a bachelor's degree in psychology in 1993, followed by residency at George Washington University in Washington, D.C. And we'll get to pivots and transitions, but ultimately ended up at Johns Hopkins University, where I was on faculty for several years. And now I work at United Healthcare as medical director.
Wonderful. Thank you so much. Tim?
Great. Good morning, everyone. It's a real pleasure to be with you here today. I went to Northwestern and graduated in 1992. I was a cell biology major. After Northwestern, I took a year off and then attended medical school at Cornell University Medical College, did my residency in New York, and then have been at the University of Washington now for about 23 years. I came here for my infectious disease fellowship and then stayed on in faculty in a variety of roles. Currently, I serve as the CEO for UW Medicine, which is our overall healthcare system, and then also dean for the School of Medicine.
Amazing. Thank you so much. Valerie?
Hi, everybody. It's really a pleasure to be here with all of you. I am Valerie Arkoosh. I use she, her pronouns, and I graduated from Northwestern in 1982 with a BA in economics, fully intending to go to medical school, which I did back in Nebraska, which was where I was born and raised. I currently live in Pennsylvania, just outside of Philadelphia. There were many pivots along my journey, which I look forward to sharing with you, including practicing medicine as an obstetric anesthesiologist for about 20 years, holding elected office, going back to school to get a master's in public health, and I now currently serve as the secretary for the Pennsylvania Department of Human Services.
Thank you so much. And Neil, last but not least.
Yes, thank you. I graduated from Northwestern in 2004 in economics and molecular biology. I did go on to medical school and a variety of medical training throughout the Midwest in Ohio and Missouri and Illinois, as well as a stint in Massachusetts before returning to Illinois, where I'm currently the chief of cardiology at Lutheran General Hospital with the Advocate Aurora Health System. So thank you all for having me today.
Wonderful. Thank you so much. This was so helpful as we get to know a little bit about you. And that's actually the perfect introduction into our first question, which is, can you share with us some of the impactful classes or experiences for you in undergrad that then led you to pursue your career path or your first job, if you ended up having a career change later down your path? So I'll snake back through and start with Neil this time, if you don't mind.
Sure. Well, yeah, my path wasn't straightforward when I was there at Northwestern. I had started in economics because I really enjoyed the questions about behavior and microeconomics, and what changes I learned about in the classroom were probably the most exciting things to me. But at the same time, I always had a penchant for science, and I knew that in high school. And I knew medical school was probably something that was on my horizon. So, I'd spend my other time doing bench research or lab work in cell and molecular biology. And so I had a variety of different interests, I think, in college. And I don't think it was clear for me where I was going to go with that or what it exactly meant. But the sciences in particular, whether it was economics or molecular biology, piqued my interest. So knowing that and taking those classes started me on the path towards medical school and public health, as a matter of fact. But those are probably the first inklings I had.
Awesome. Thank you so much. Val?
So I wanted to go to medical school from a very young age. I had a brush with an illness when I was about 6 years old that ended up thankfully being nothing serious, but initially it was thought it was very serious. And those doctors that took care of me had such an important impact on me. And I thought, wow, I hope maybe I can do that for some other family, other kids someday. So I wanted to go to medical school from a very young age, but I came from a family that was, no one in my family was medical, and my father owned a small business. And I thought, well, maybe it would make a lot of sense to learn something a little beyond science. So I decided to actually major in economics, but of course, take all the courses that I needed to prepare for the MCATs and have that very solid background in science. I always loved science. But I loved economics, and that economics degree has turned out to be incredibly important to everything that has come next in my career. And unlike Neil, I was a macroeconomics fan. Micro was not my thing, but that idea of macroeconomics and how it impacts what I do now, really, which is population health, it's funny to sort of connect those dots over the years to see how that love for that sort of bigger picture and what moves groups of people has really impacted me over time.
Perfect. You're speaking my language. I really like population health, especially as I look towards my MPH. Thank you so much. Tim?
I also always knew that I wanted to go into medicine. I was not only impacted by my time at Northwestern, which I would say is really not just the classes, but more so the people and the people from different backgrounds coming from a very small town from Iowa that really impacted me. But more so, I grew up through the 80s with really watching many of my father's friends die from AIDS. And my father actually died from AIDS in 1992 during finals week of my senior year. And so that really impacted me both in terms of going into infectious diseases, but really seeing that intersection between medicine, public health, and the impact on the communities we serve. If you recall with HIV, given where we were from a science standpoint, when that first we started to hear about these unusual cases in the early 80s, it took several years before we even knew what the causative agent of AIDS was. And then another year before we had an actual valid test. And then at that time, there was no reason to get tested, because if you got tested, you only faced discrimination, potential loss of insurance, loss of employment, and there was no therapy, right? And so I kind of grew up through that environment. My father didn't get tested until 1989, at which point he had 0 T cells, which essentially means he had no immune system left. And he died 4 years before really combination therapy came evolve and could have changed that outcome. But that really has, I think, driven me in terms of my career and thinking about that, again, those intersections and the risk of politicalization of some of these outcomes, right? If we look at what happened with the pandemic now more recently, and to compare and contrast that to what we experienced in the 80s. For me, though, Northwestern provided that home during that period of time. I had wonderful colleagues, friends that really helped me through really a challenging time. And I have to say, the education obviously goes without question. It's outstanding. You will be so well prepared for whatever you go into your next journey in life. But it's really the people that you're connecting with, both your faculty, but more so your peers and those fellow students, that really are going to shape and impact you as you go forward.
That was so powerful. Thank you, Tim, for sharing that with us. And Rochelle?
Hi. So like several other people, I knew I wanted to be a doctor from a young age. My recollection was maybe middle school or high school, but interestingly, when I graduated from medical school, my parents had framed this composition I wrote, I think in first grade, where I wanted to be a pediatrician, part-time model, and part-time IBM worker. I don't know. None of those other things worked out, and I didn't go into pediatrics, but it was sort of interesting to see that my interest in medicine, predated my own recollection. So I had that foundation, and I was involved in a lot of organizations in high school, like through the YMCA and some other sort of pre-professional programs. So I knew I was going to be pre-med, but when I started at Northwestern, I felt like I had to be, I came in as a chemistry major with a math minor, which again, didn't last very long. That's because that's what I was good at in high school. And so I just thought that was a logical transition. And I was sort of under the impression you had to be a biology major or some hard science. And so my experience at Northwestern there were a couple of pre-med groups, and I don't remember the names of them, but those were very helpful because it introduced me to people that were in tech, that were, that were in engineering, and people that were in psychology, which I ultimately ended up transitioning into, that you could go into medicine from all of these varied backgrounds. So that was very helpful to me. And it was just helpful to stay in contact with all of my friends and through these organizations to keep us all on track. We all had the same ultimate goal, but our paths to that goal were quite different. So, my time at Northwestern was great. And I loved psychology, and, was so happy to, some of those prerequisites that you had to do. I think intro to psychology was a requirement. And I sort of, thought it was just a class I was going to blow off because I was more interested in calculus 5 or whatever I was taking. But I loved it. So it was a great experience for me. So that's how it all started.
Wonderful. Thank you so much. And this is another great introduction into our second question, which is, can you talk a little bit about your path to an advanced degree, or advanced degrees if you have multiple? And, let us know, did you take time off? Did you go straight through? And, kind of why that was your path. So, Rochelle.
Sure. So I did take the traditional path straight from undergrad to medical school, and then medical school to residency. So again, I left Northwestern, went back to Kentucky, where I was from, did my medical school there. And then I went to DC, to George Washington, to do my residency. And then I did a chief residency year, which is, for anyone who doesn't know, it's just an additional year after residency, sort of a position of honor where you function as a sort of hybrid between being a resident and being a junior faculty member. And there's some administrative roles where you're doing sort of, frankly, HR type roles where you're keeping track of schedules and that sort of thing. And that kind of put the academic and administrative bug in my ear. And so I started off my career, I stayed on as faculty at GW, and took on a variety of administrative roles, teaching medical school and medical students and residents rather, a lot of hospital committees, the typical academia work, which is very busy and sort of all over the place, but it fit my personality and I really liked it. But I decided about 5 years in that I was interested in research because I had done a program. You know, you get exposed to all these opportunities in medicine, and being in DC, I had the fortune of interacting with a lot of prominent people in medicine. And so I had been introduced to someone that was at UNC and they were starting this program. So I did this while I was still on faculty. I did a distance program at UNC, met some more prominent people, so on and so forth, and just really was interested in doing research. So then I decided to leave my academic faculty position and do a fellowship, a 2-year fellowship at NYU in clinical investigation with a concentration in public health research. So I went to New York for a couple of years, which was fantastic. I won't go into great detail on that, but if we talk about pivots and transitions, I can come back to this because leaving, you know, sort of an adult job, an attending job where you're finally making a salary and then going back to being a fellow was quite a choice to say, for lack of a better word, but it was fantastic for me. And so I left that experience and joined the faculty at Johns Hopkins University, where I did clinician, educator, investigator, and clinician. And so I did research, teaching, and administration. So it was an omnibus role, very busy, very challenging. And I stayed there for another 5 years before I transitioned out of clinical or academic medicine into my current role. So I guess I'll just stop there and we can talk about other parts of it later.
Perfect. Thank you so much. Tim?
I think one of the wonderful things about medicine is that there is such a breadth of opportunities and you never know where you're going to end up. You know, my path was I actually got accepted to medical school, deferred for a year. And then, as I mentioned, went to medical school, did residency in New York, was a chief resident as well at Memorial Sloan Kettering, and then came to University of Washington. And as a fellow, I really thought that I would be in a basic virology lab. And that's where I started in my fellowship, working on HIV accessory proteins. And then, you know, kind of came to the realization that long term, did I see myself writing grants and supporting myself, or was I more what we refer to as a clinician teacher, meaning enjoying the teaching, enjoying the clinical work? And so from fellowship, I took a position as faculty where I had not only being able to attend in our HIV clinic, our general infectious disease clinic, but also began what's referred to as our antimicrobial stewardship program, which was the first in our organization. So how do we use antibiotics appropriately? Use them when they're necessary and not use them when it's a virus, as an example, to decrease the risk of resistance. And then I ran our infection control program, was associate medical director for Harborview Medical Center, which is our county safety net and trauma center here in Seattle. Did that for 12 years and gradually got involved in quality improvement, clinical risk management. And I really enjoyed kind of that system approach of thinking about how can you improve the care for everyone in addition to the patient that may be right in front of you in clinic, and really liked those sort of system level challenges. And then prior to my current role, I was the chief medical officer for our organization and president of our faculty practice plan. But with that infectious disease background, I was able to, you know, back in 2009, led the response for us to H1N1 pandemic, led the preparation for Ebola and the concern about the potential for Ebola in 2014, and then led us through the more recent pandemic. And so was able to balance both my administrative roles, but also my infectious disease interests and background, which really served me well, especially through the pandemic. So I just share that to say that I had no envisionment of going into administration or certainly being in the roles that I am now when I started medical school. But sometimes those opportunities come along and you have that ability to really follow your interests, whether you want to do research, teaching, clinical care, administrative work, public health work, There's just this wealth of opportunities in medicine, which I think just makes it a wonderful field to consider.
Thank you so much. I happen to have H1N1 as a kid, so that's what drove me into kind of public health, and then, you know, living through COVID like we all endured. So thank you so much, Tim. And then Val.
Well, I started out in the very traditional pathway. So graduated from Northwestern, was fortunate to get into med school and went straight to medical school. And then moved to the East Coast for my internship and residency. I am an anesthesiologist by training, but I specialized in obstetrics. And it was really spending most of my clinical time on the labor and delivery floor that has impacted me into everything that came next. But I was very much a typical academic clinician. I was doing clinical research, you know, publishing papers, kind of working my way up that academic ladder. Ultimately was chair of my department for 5 years. But through the course of all of that, it was really my patients that kept me grounded. And, you know, it can take a long time to have a baby. And so I would spend a lot of time with patients, just chatting with them as they were going through labor, checking on them if I was caring for them. And it was from their stories that I really started to pivot. And I took care of many individuals who were from communities that were very underserved and under-resourced. And I still remember one day talking to a pregnant person who had just been diagnosed with diabetes and was quite ill and actually had to be hospitalized during their pregnancy. And I was talking with her about what her access to food and what she ate was. And she just looked at me and she said, you know, Doc, I have 2 kids and I'm 8 months pregnant and I have to take 2 buses to get to a grocery store that sells fresh fruits and vegetables. And she said, I can get to the grocery store, but I can really only bring 1 bag of groceries back because, you know, I've got 2 little kids. And as someone who had been fortunate enough to not have to worry about how to get to a grocery store, it really struck me, kind of stopped me in my tracks and began a real pivot for me. And I realized that this wonderful person in front of me, while I could be helpful to her, what she really needed was a grocery store in her neighborhood, and I couldn't write a prescription for that. And so that became, you know, a long journey for me. I ended up going back to school and getting a master's in public health at the Bloomberg School at Hopkins, and ended up doing a lot of work as I finished that MPH. The focus of my MPH was U.S. health policy. And just as that was coming to an end was when then Senator Obama was running for president and then became president. So I got very involved with an organization that worked with the Obama administration on healthcare reform in the run-up to what became the Affordable Care Act. And that experience really opened up my world to elected office and serving in a more government or public policy role. Long story short, I did end up running for office. I served as a county commissioner here in Pennsylvania, leading Pennsylvania's 3rd largest county for 8 years, and also ended up being in that office during COVID and really leading kind of the regional response to COVID here in southeastern Pennsylvania because of my unusual background. And now I'm fortunate enough to have been asked to serve in Governor Shapiro's cabinet here in Pennsylvania, leading the Pennsylvania Department of Human Services. So I now oversee an organization with a budget of $19 billion. We have the Medicaid program, but so many other programs under my purview and 16,000 employees. And so from this space, I am able to take that focus that I still carry with me on those social determinants of health, and incredibly privileged and fortunate to be in a place where I can now do that work statewide and put policies into place through Medicaid and other programs that I oversee to really, I hope, make a very meaningful difference in some of those just intractable issues that prevent people from being healthy. So it's been quite a journey, but one that Northwestern prepared me for incredibly well. And you know, I still, like others, am very close to a number of folks that I went to school with, and they've kind of bolstered me along the way. So don't lose track of your friends. They're the best.
So informative. Thank you. And Neil?
Yeah, thank you. It's really interesting, hearing the panel. And I'm going to try and answer the question a little differently as well, because I think as I listen to everyone's story, and I think what you'll hear from everybody on this panel was maybe none of us expected to be where we are today from the vantage point of where we started at Northwestern. Um, but I think it's that foundation that will get you there. So I did go straight to medical school after my time at Northwestern, and then went on to 9 to 10 years of different training within the field of cardiovascular medicine as my advanced training and experiences and opportunities took me to different places. But certainly, like everybody else, never expected to be in the place I am today, doing what I am doing today. And I think at the end of the day, what drove a lot of that was curiosity and opportunity. The same things that maybe compelled all of us to answer questions about how do we take care of our pregnant patients or our patients with AIDS, or in my case, patients with heart disease or heart attacks. As we tried to figure out those solutions and ask those questions and be good at it and do well at it, you start to figure out, well, what if we can all be better at it? Or what if my teammate or my partner or my group or my hospital can tackle this problem? And how do we find those solutions? And if I have ideas that I want to try to use, how can I make a positive impact by doing that? And I think as you go on that journey, the opportunities you'll have at Northwestern, which is very early on, will open those doors. And as your peers and colleagues go through that too, it'll become infectious, and you'll feed off of that. And so it'll take you to places you may not have expected. So in my current purview, I do some administrative roles across the state of Illinois for our healthcare system. And I get to work with people in all different hospitals looking at the same question of how to help people or organizations deal with heart attacks or heart disease or heart operations. And it's that drive that I think brings us to different places. And as you become more successful and have those opportunities to make those impacts, you start to learn more and more about maybe the organizational constructs around you where you can participate in those, and they're extremely rewarding. And so as you think about whether to go straight to medical school or straight to your master's in public health, you may not have to think about it that way, but rather take it as it comes and see what presents itself and what you really want to do at this time that's going to make you excited, because those opportunities will always be there. And I think as all four of us on the panel have explained, we all found it a different way and maybe at a different time. But we got there, and you guys will too.
Thank you so much. I know that resonated with me, and I'm sure many others of us on the call. Kind of going back a little bit, retrospectively, how did your background in arts and sciences kind of help you and play out in your work today? Maybe you didn't realize that at the time, maybe you did, but I think that would be something that'd be really helpful to students in that position now, especially as we look forward and we're in that coursework currently. So Neil, if you would start us off, that would be great.
Yeah, sure. It can even be simple things. So I did major in economics as well, the micro side, not the macro side. But I can distinctly remember times sitting in a classroom where we had to use spreadsheets or use Microsoft Excel and just learn how to do that. I mean, at that time, I didn't have a clue of how to even put a spreadsheet together. But even that basic class, I use routinely now. And I can actually fondly look back at those times, learning how to do that and recognizing that that was where I actually developed those skills, because had it not been for those classes, I don't know where I would have come across those. And those things came back and were recurring themes in different jobs or positions I had. So I do think that, the arts and sciences, at the end of the day, gives you a lot of different tool sets. And if you go on to the master's, whether it's in public health or a degree in the medical field, you're going to use a lot of different tools, probably everything from spreadsheets to learning how to put together maybe an organizational chart or whatever it might be. And you'll probably pick and choose things from your different classes. But at the end of the day, as a numbers and science guy, those things always stuck with me.
Thank you, Neil. Val?
I think for me, one of the greatest things about Northwestern was the fact that it was a quarter system and that you could take so many different classes. I can still remember my friends who'd gone to schools that had 2 semesters. I was just able to take and be exposed to so many more things than they were. And so while I, obviously had to do everything for my economics, all those requirements for that degree and get all the stuff that I needed to take the MCATs, I still found time to take art history classes. And I took so many philosophy classes that I almost had a minor in philosophy. And it was really that opportunity to expose myself to so many different, even if it was just a sort of introductory class in something, that has served me so well over the years. And the work that I've done every step along the way, as a physician, as an elected official, and as now a government official leading an enormous agency, you have to be able to connect with and relate to all kinds of people who are very, very different than yourself, who grew up with different backgrounds, different experiences. And that exposure at Northwestern, coupled with the diversity of the student body, I also came from a community that was not diverse at all. And growing up and even through high school, I really didn't have any friends that didn't look any different than me. And so the opportunity to go to Northwestern and meet people from so many different backgrounds and really learn and appreciate the richness that diversity brings to conversations and to projects and to everything that we do in our adult careers now was really incredible. But I would urge every one of you to just squeeze in any additional classes just for fun that you can along the way, because they really just give you kind of the richness to that tapestry that are those things that you carry with you, and you just never know when they might come in handy.
Awesome. Thank you so much. Tim?
Yeah, I would just build a little upon what Val mentioned. I think one of the strengths of Northwestern, not only within the College of Arts and Sciences, but across the university, is the breadth of opportunities, both in terms of the individuals and their interests that you're exposed to, but also the opportunity to really pursue things that may be completely different from, in my case, cell biology when I was at Northwestern. And I think there's a risk for those of you who may be more in a pre-med direction that you get so focused on that path, but really stop and take advantage of all of the other offerings that Northwestern has. It's absolutely critical. When I think of medicine, and we often talk about the art and science of medicine, on one hand, there's the scientific discovery, but the reality is medicine at its foundation is a very human profession. It is about that relationship you have with an individual patient, with the family, their trust in you as a physician to care for the health of their loved ones or themselves. And it's that personal connection that really makes a good physician. Yes, you need to know the science, but it's the ability to relate with people and build upon that human connection. And as many of us have talked about, it also ties into the communities we serve and our focus on the most vulnerable within our communities. And how do we ensure the same access to care, the same quality of care? A huge focus on healthcare equity now, because medicine, unfortunately, has a long history of inequities that have really been highlighted as we've come through the pandemic. And so I would urge people, just take advantage of the wealth of opportunities that Northwestern provides you. It's a strength of the university, and one that if you do go into any health profession related field, it will only serve you well. The science will always be there, but it's those other aspects that truly will come to the fore as you go through your path.
I love that. Thank you. Rochelle?
I spoke a little about psychology already, but my psychology major my friends all know, and they sometimes will repeat, well, you know, Rochelle has a bachelor's degree in psychology. I'm always saying that sort of as a joke, but it really has helped me in every stage of my career and life. I mean, it's helped me with my patients, you know, in direct patient care. It's helped me intercollegiate, you know, with other colleagues in groups and committees, you know, any interpersonal relationship, you know, a psychology background has been helpful. You know, it's helped me with, you know, at multiple stages in my career. I've had to do those Myers-Briggs tests, and there's always these team building activities. I mean, psychology theory is at the foundation of a lot of these things. So I feel like understanding that has been helpful. And, you know, quite frankly, I'm in the midst of the Erickson stages of development right now as, you know, I'm taking care of an elderly father. That's why I moved back to Kentucky. And so, you know, I jokingly always reference generativity and stagnation. If anyone doesn't remember that, just Google it. But, you know, that's part of caring for an elderly person. And, you know, as we all transition through life stages. So I can't express enough how much my undergrad foundation with psychology has just really benefited me throughout my life and career.
Thank you so much. I think, you know, we've got about 9 minutes left, and there's 2 questions that stood out to me. So I want to get those definitely covered before we transition over to student questions, which I'm sure there will be many. So I know many of you already did this, if not all of you, but can you, you know, give us again a quick overview of just your industry and then also your job function, kind of including your day-to-day, you know, what that involves. And I think that'd be helpful for us students as, again, we think about different industries we might be interested in and want to understand kind of those daily commitments as we transition out of being students. So I'll pass it on to Rochelle.
Sure. So as I mentioned, I'm a medical director at United Healthcare. And how do I start? You know, the managed Medicare and utilization management, this is all a part of non-clinical medicine that, you know, frankly gets a bad rap. You know, it's sort of the dark side. You know, oh my gosh, you transitioned to the dark side, you know, when I left academia. But it's an entire aspect of medicine that I certainly didn't have to interact with much at all in academia. So I was very naive to it. The fact of the matter is that, you know, there's a finite amount of money to pay for all of healthcare, and it is managed. I mean, you know, facilities have to manage it, individuals have to manage it, and insurers have to manage it. My experience as an academic clinician was that I just didn't deal with that. There was a utilization management nurse who just kind of did all this stuff behind the scenes. No one really, I just really wasn't involved. So when I started in my initial role I wasn't at United Healthcare, I was with United Health Group, which is the umbrella organization that owns a multitude of organizations. I was at a smaller company within United Health Group. I was doing utilization management, looking at hospitalizations and determining whether it was the appropriate level of care. And, you know, that was fine. It was very somewhat cookie cutter for me. So I sought other opportunities, and long story short, ultimately wound up in Medicare appeals, which is where I work now. I've been doing that for 5 going on 6 years. And for me, you know, I thought that this would just be a transition in my career. I was, you know, at Hopkins, very busy, you know, trying to do basically 3 full-time roles within one. And, you know, you get NIH funded, but then, oh, can you also teach an additional class? Can you write this? Can you precept an additional clinic? So it became like 75% protected, squeezed down into, you know, actually being 52% protected. So I just sort of felt like, okay, I need something different. So I left thinking it would just be a transition. But the more I experienced at United Health Group and then ultimately United Healthcare, I realized that as a physician, I was doing very much the same things. I wasn't doing direct patient care anymore, but I'm still looking at individual members now. You know, we see them as members of United Healthcare, but not patients. But we're looking at their care and trying to figure out what the appropriate care, the appropriate care level and setting are. So it's somewhat, even though it, again, still gets a bad rap, I think it's important, you know, just to keep in mind, just a very brief background. Initially, a lot of these decisions about what care is given and paid for was done by nurses, non-physicians. And over, I'd say probably the last decade or so, the number of physicians that have been involved at this level has increased. And so I feel that I have a voice at United Healthcare. I'm working particularly with Medicare recipients, which is my forte as an internist, as a person who, cares about elderly and disadvantaged patients. My entire, academic career has been focused on those disadvantaged population and health disparity. So I'm really doing the same thing, just from a different angle than I was in direct patient care. So I look at my career as a trajectory. So now I'm completely non-clinical. I do some telemedicine work just on my own, but my role, my 9 to 5, not really 9 to 5, my day job, we'll call it, is purely non-clinical. But I feel like, I'm still I still have to be board certified. I still have to maintain licensure. I still have to maintain continued medicine credits. I'm not formally a doctor. I'm still a physician. I still go to professional organization. So my role has changed, and the sort of vantage point with which I'm approaching medicine has changed, but it's still medicine, and it still feels like I'm helping people just from a different vantage point. So that's it in a nutshell.
Thank you so much. Tim?
So my role at the University of Washington really is a combined role. So on one hand, I'm the CEO of UW Medicine. So I oversee all of our hospitals, our clinics, our ambulance, our faculty practice plan. But I'm also the dean for the School of Medicine. And our School of Medicine is a little bit unique. For over 50 years, we have 6 campuses across 5 states. So we are the medical school not only for the state of Washington, but Wyoming, Alaska, Montana, and Idaho. And we have students who spend their first 18 months in each of those states. And then during their 3rd and 4th years, during their clinical training, they can rotate anywhere across those 5 states. And there's a big focus on rural and underserved medicine across that large Pacific Northwest. On the other hand, we also are one of the leading biomedical research universities. We have more research funding than any other public university, and are only second to Harvard across the entire country. So we have the balance of both focus on primary care, rural medicine, as well as a very large biomedical research complex. And my role really is to integrate our clinical, our equity, education, research, and our well-being. And I emphasize the well-being because as we come out of the pandemic, the healthcare environment has been really challenging. We face challenges in terms of access to care, equitable access to care. We face challenges from our workforce. We saw a large exodus, particularly among nurses, but also physicians during the pandemic. And so a lot of turnover. And our hospitals are financially challenged. In fact, if you look in Washington State as an example, 85% of our hospitals are losing money. So it is a very challenging time in healthcare as we adapt to this new environment. What I love about my job is that it is that intersection, right? And it's really not my doing each of those, but it's really how do I facilitate the teams that are leading our research efforts? How do we translate what we're learning in the lab into direct impact for our patients and the communities that we serve, right? How do we educate the next generation of healthcare professionals? And right now, it's really how do you also incorporate new technologies such as generative AI, and which is going to completely change the way we practice medicine, in my view, over the next 5+ years. And so it's also a very exciting time in medicine. And again, I have the privilege of really being in a position of working with a wonderful team, but really thinking about how do we integrate all of these various activities in a leading academic health system.
Thank you so much, Tim. Val?
So in my current role, I lead the Pennsylvania Department of Human Services, and under that umbrella is the Medicaid program, but also programs around mental health, programs for individuals with intellectual disabilities and autism, people with physical disabilities, We have housing work that we do, a whole number of other kind of supports and services types of programs. And so, you know, it's interesting as I listen to everyone else speaking, what I do a lot of is translate for people. So I have to help explain why it is so important that our Medicaid system, which is the health insurance system for individuals who are lower income, why it's so important that we pursue opportunities to connect people with food as medicine, to make sure that people have access to healthy food, to help translate for other, you know, people that are in our General Assembly, as we call it, our state house, our state senate, why housing is so critical to people's health. You know, why these things really matter. If someone is re-entering their community after incarceration, why do we see such a spike in opioid overdose deaths? And what can we do through our programs to help prevent those things? And, you know, I take those things for granted, those connections, you know, to me and probably to many people that are listening. It's just like, of course, like that's what we do. But there are so many people for whom those connections are really curious and not at all obvious. And so in order for my work to be effective, I have to make sure that the elected officials that I work with, our governor, our congressional representatives, actually understand those connections. And so I draw from every aspect of my background in this work to not only work as I oversee all of these programs and the work that they do and the many policy choices that we make along the way in implementing this work, but also then making sure that I'm translating that in a way to the people that can help provide more resources to this work, or to advocate for a particular bill that is working its way either through our state legislature or through our United States Congress, and why it matters to the actual people that those folks are elected to represent. So I do a lot of that kind of bridging. And really, it's kind of a lot of translating, but it has absolutely drawn in every bit of my background along this way.
Awesome. Thank you, Val. And before we turn it over to student questions, Neil.
Thank you. So my day-to-day is still split with clinical work. So I spend about half my time taking care of patients. I will operate in the cardiology space 2 to 3 days a week in our cardiac procedure lab. And then the other half of the time, I will work on some of these more, though on a more local level, some of these more administrative roles you've heard about, where we're trying to figure out how to deliver care within our health system to our patients in a way that's not only high quality, but obviously has to sort out the things Rochelle and the other people on the call are talking about. It has to be equitable, it has to be affordable, and it has to be efficient. So my time is sort of, my day-to-day depends on the day, and it's sort of split between two different worlds. But it's one that I enjoy both sides of tremendously.
Awesome. Thank you so much, Neil. I'm sure we have a lot of student questions. This is such a great panel, and I'll pass it on to Andrea now.
Hi, everyone. Just a reminder, if you have any questions for any of our panelists, please send them to me, or you can raise your hand and I can call on you. But we have a handful of questions to start us off, and I'll just leave this open to whoever wants to jump in, and we'll get started that way. So my first question from the students is, how do you try and keep focus of your passion and interest to motivate you through undergrad and med school when classes and life were challenging?
Note that we're all laughing. I just have to say, it's not easy. You know, I think somebody said to me about, I don't know, 15 years or so ago, you can have it all, you just can't have it all at the same time. And I think that was really, really good advice. I had gone through a period of my life where I was sure I could have it all at the same time, but you know, it doesn't always work out that way. And so I think sometimes you just have to prioritize in the moment to just, kind of keep moving forward. But what's always been helpful for me is to just keep my eye on kind of what that ultimate goal was. And for me, it's just been solving these problems, like what do I need to do to get that woman that is still in my mind every day, a grocery store in her neighborhood, and what are the 100 things that need to happen between that conversation where I am now, right? But if you just sort of have that guide star and just keep along the path and know that you'll get there eventually, it doesn't have to be next week. You've got time. And don't forget your family and prioritizing your family and your friends. It is so, so important. And at the end of the day, it's in many ways the most important thing. So you do have to find time for that balance, but it's not always easy, I'll be honest.
Yeah, I would just echo. I think finding that balance is really, really important, and remembering this is, it's a marathon, not a sprint. Meaning that occasionally there are acute, urgent, emergent issues that you have to deal with, but ultimately you've got to figure out how you pace yourself to be able to sustain yourself through that. And for me, it's grounding back into why I went into medicine, what excites me, that passion. When I'm on service for the infectious disease consult service, that's like a vacation for me, right? Because I can go in the hospital, I can see patients, I'm with our residents, our fellows, our students, much like Neil described. That clinical connection kind of regrounds me of why I do what I do. And interacting directly with patients in that way really brings you back to those core values and the mission that you have. And so it's finding what is that core that you can always go back to kind of re-energize yourself, but also making sure that you take care of yourself along the way. Because if you don't take care of yourself, you're not going to be able to take care of your team or your patients or those that really depend on you in your professional career. You've got to find that balance.
Yeah, thank you. I think that's great advice, especially as we're in week 7 of winter quarter. I think that's a great reminder for a lot of us. And that's a great lead in into our next question, which is how do you balance working hard for others while taking care of yourselves? And how have your self-care strategies changed over the course of your careers?
I can pipe in on this one. I feel like just in the more recent years, post pandemic, I think all of our self-care habits probably have changed. That sort of forced us all to think a little differently. But earlier in my career, certainly, I don't know that I did a great job of self-care, to be honest. I mean, you're in the grind, you're trying to finish, first it's get into medical school, then it's finishing. My whole 4 years of medical school are a complete blur. Anything like in the world politics, anything major that happens, and I'm like, oh, I didn't know that. I'll look back and I'm like, oh, that's because I was in residency and I just, or in medical school, and that was in the 4 years that I had no idea what was going on in the world. So, you have your head down and you might miss things. There might, unfortunately, there are life events that you sometimes miss, friends' weddings, things like that, because you just can't. But, you do have to take time. I think probably since most of us were in training, I think there's more emphasis since the workout, all of us trained during a time when the work hour rules were non-existent. But now there is more attention by these graduate medical organizations, GME and whatnot, that are focused on making the training period less arduous. I mean, it was fairly painful at the time that most of us trained, but I think it's better. I hope it's better. But you do have to prioritize, this has been mentioned, and try to find things, whatever that is. I mean, hobbies, travel. I also will add, it sort of relates back to the other question. Because I'm a person who went straight through and did everything in order, I looked at, there was a 50-year-old medical student I remember in my class, and we all thought, oh my God, how could you be a 50-year-old medical student? But now I think, that's pretty cool. Or, there were people who were lawyers before they went to med school. There are people who had entire other careers and then decided to go back to medical school. So your pathway is your pathway. And if you, if your goal is to go into medicine, but you end up in a less direct path than others, that's okay. If you have to take time off, if you choose to take time off to pursue other interests or have a family or whatever, fill in the blank, that's okay. The opportunities will be there. So don't stress out about doing what everyone else is doing or what you think is the only path or the traditional path. But along the way, rely on your family, rely on your friends, travel, have experiences. We all have to protect ourselves somewhat. Now I'm a pickleball fanatic, so that's how I do self-care these days, is pickleball.
No, I think that's great. Thank you so much for sharing that. It's important to save time for yourself as well as we go through this journey. So my next question for you guys is, if you could have taken a gap year, would you have? And looking back, what experiences might have been meaningful to you that you wish you could have done before medical school?
I can try and answer that one. I think a gap year, as it is, that taking a year off, I guess, before moving on to some training, sounds really exciting. I think looking back on it, would I have taken advantage of it? I think absolutely, and probably enjoyed either traveling or exploring a hobby that I may not have been able to necessarily pursue at the time. But I think at the end of the day, even as I think about that today, whether I take time off or try and venture into something that'll take me away from my professional work, I sort of always find myself coming back to my professional work. And the reason I say it that way is because I think it's something I enjoy. So I don't know that I could imagine right now being away from what I do for a year. And I suspect if I took a gap year, I would probably mix in some science or something that I was interested in at the time, because while it's good to get away, it always sort of pulls me back to what what my passion is and whatever that ultimate goal is, to get through medical school and get on to training. That's just my personal behavior. But I don't think there's any sort of negative connotation with this gap year, taking time off. I think you pursue what you enjoy at the pace you want to do it, and it'll bring you right where you need to be.
Yeah, I was just going to add, I think there's, most of us, I think, went through more traditionally. And, I deferred for a year, but it was really because of the death of my father. Otherwise, I probably would have just gone straight through as well. But when you look at our students now coming into medical school, more and more are coming to medical school after either, if not another career, a couple of years or some time exploring other parts of life or other experiences. And from an admission standpoint, we really focus on a holistic approach and really look at that breadth of life experiences for individuals. And so I would just say to the students that regardless of what your major or your interests are, don't be afraid to explore other areas or to take time off. You're not going to be penalized in any way. And in some ways, with medicine, having that additional breadth of experience is really beneficial as you come in to medical school. And again, I say that recognizing the panelists here, we were all much more of a traditional, but more and more these days, I think you see a lot more quote non-traditional student pathways, and that's okay. In fact, that's a positive thing in the eyes of the medical schools, and it just adds diversity of experience to our medical school classes, which really makes the entire community richer.
Thank you so much. This is a last really quick question. In a few words, what is one thing you could wish you could have told yourself when you were an undergrad?
I would just say to have explored more, to taken more risks particularly in classes outside of my focus in biology. I think that's one thing that I wish if I were able to go back, I'd do differently.
I would just say, in addition to the pivot, don't be afraid to pivot. Don't be afraid to take up opportunities. Don't be afraid to ask questions. went to homecoming this past October, and I was standing with a group of my classmates, and an undergrad student just walked up to us and was like, "Are any of you doctors?" And I said, "Well, I am." And he's like, "Can I ask you some questions?" And he just started pummeling me with questions about undergrad and what should he take and this, that, and the other. And I remember we talked for probably 30 minutes. And I thought, I never would have done that. You know, I just would never have gone up to a group of strangers and interacted with them. But I think, you know, ask questions. If you are attending a lecture and there's someone there, even if they're, you know, someone that you perceive as prominent or what have you, try to ask them a question, get their email address, send them an email afterwards. I mean, don't be afraid to ask questions as you're choosing your career path. Just ask questions. That's my advice.
And I would tell myself to stop worrying so much. It's going to be okay. It is going to work out, and to be confident. You know, I think particularly when some of us were going into medical school, you know, being a woman was still a bit of a problem, frankly. You know, there was a lot of questions about whether women should even be going to medical school. And so, you know, just be confident, be true to yourself, and find that thing that you're passionate about and just follow it. And it might take you on this very circuitous journey, but you're going to really enjoy the journey. Don't forget about the journey. It's not about the end. It is actually about the journey. And I think when I was in college, I was always focused on the end, but it's really the journey that's so meaningful.
Yeah, I completely agree with everyone on the panel. And I would say if I could tell my college self something, it would be maybe to join more of the student organizations. You know, I'm so amazed at how many incredible people I was surrounded by at school, and how important they were to who I became and what I learned, and how much it changed me. And so I wish I could have joined some more of the student body and all the amazing things they do. I think that would have been incredible.
Thank you guys so much for those great answers. And we'll just wrap up. I know we're a few minutes over, so thank you guys for hanging around. And thank you so much for logging on today. And please join me in thanking our alumni speakers for sharing such great insights with the group today. I know a lot of it was really helpful for me as I take on graduating. So thank you guys so much. For all of the students, please keep an eye out for a follow-up email from Joseph with the Waldron Connections program with the alumni information, and an email from Grubhub with your $20 credit. The Waldron Connections program typically buys students lunch when they attend these alumni programs. So they're saving students a little bit of money to buy themselves a meal. And thank you all so much again, and we hope you have a great rest of your day. Go Cats.
Thank you.
Thanks, everyone. Have a good one.
Have a good weekend.
Take care, everyone.